Here at Illawarra Animal Hospital, we do some surgery on a regular basis for dogs which have upper airway problems. We do see it occasionally in exotic cats as well, but classically dogs which have difficulty breathing, particularly in the summer months as things warm up, include French Bulldogs, English Bulldogs. We do see it in Cavalier King Charles Spaniels. I've also done upper airway surgery in a Kelpie, so it can be any breed really, but particularly the flatter faced or brachycephalic breeds are those which do suffer upper airway problems, and that comes as a result of a variety of conditions that they suffer. Often they can have narrow nostrils, and we can certainly see that one from at the front by a simple examination with the veterinarian. But once we anaesthetise them, we can also have a look down the back of their throat, and we can see long soft palates or everted laryngeal saccules. They can also have narrow tracheas, but unfortunately at surgery it's very difficult to do something about those. But the long soft palates, the everted laryngeal saccules and the narrow nostrils are all something we can fortunately do something about. Problems that you may see with your dog which has these particular problems are the inability to exercise on hot days. They often find it very difficult to breathe. Some of them can find it difficult to snore, and one of the classic things we hear from owners is after the surgery is done, they didn't realise how bad it was before until they see what it looks like once they've finding it much easier to breathe post-surgery. There's a lot involved in the surgery, but as I said to you, we can widen the nostrils, we can shorten the soft palate, and we have an instrument here which is quite rare in practice, which makes that job particularly easy and safe at the back of the throat to avoid bleeding and to minimise swelling that we can see post-surgery with these guys. But their quality of life post-surgery is vastly improved. The care immediately after the surgery is very, very important, and so we offer a service where we have an after-hours nurse stay with the veterinary technician, a highly qualified professional that stays with them overnight and is able to monitor them very, very closely and administer medications and treatment if required at all, and they also have access to be able to call the vet in as needed. So that 24-hour care is very, very important post-surgery to make sure that everything's going okay and to help them out with different treatments if needed. So we're very proud to be able to offer that in the Illawarra Animal Hospital, and very thankful to our veterinary technician team who offer that because it was something that was previously only offered at specialist centres in Sydney. So very proud and happy to be able to do that, and as the surgeon that makes us all very happy with the outcome. The good news is that upper airway surgery in dogs and cats can be a life-changing experience, and they do so much better when they can breathe and get that oxygen on board. Sadly, the other side of that is that there are animals out there that remain untreated, and unfortunately, particularly in the summer months, spring as it comes into summer and we get some hot weather, they can really struggle, and it ends up in an emergency which isn't always favourable to them. So it's much better to be preventative about it and get the surgery done, at least to come and have a discussion about it so that we can opt in what the best solution is rather than end up in a respiratory emergency down the line. So if your dog or cat's keeping you up at night with the snoring, or alternatively finding it difficult to breathe or is a very noisy breather, or they're going out for walks and they're running out of puff really quickly, by all means give us a call here at Illawarra Animal Hospital. We'd be only too happy to help you out wherever we can.